And we are back. June is Post-Traumatic Stress Disorder Awareness Month. An estimated 1 in 11 people will be diagnosed with PTSD, I should say, in their lifetime. The Program for Anxiety and Traumatic Stress Studies, PATSS, is a specialized program that's offering a state-of-the-art approach to patient care, bringing innovation to tried and true therapeutic techniques. And we've got now with us the director of the Program for Anxiety and Traumatic Stress Studies, Dr. JoAnn Difede. And we thank you, Dr. Difede, for being with us. And when we talk about 1 in 11 people, that is a pretty significant number. And when we look at PTSD, it seems as though this is something that continues to be more and more on the rise, given the things that we're finding occurring even in society.
Uh, yes, the rates of PTSD are very high, but there is hope. When I started doing research 25 years ago and started the Program for Anxiety and Traumatic Stress after the World Trade Center to take care of our first responders, there were very few treatment options, and awareness of PTSD and the stigma of mental health were very significant. A generation later, while we don't have a cure, there are many opportunities for brief evidence-based treatments that are available now that were not. And so while we are having many events in the world, especially the pandemic, which put all people in densely populated areas at risk, excuse me, there is hope. And at PATS, we are doing some of that cutting edge research and have federally funded research to take care of military sexual trauma, combat-related PTSD, and now our healthcare workers from front lines of patient care, and including the support team.
Yeah, you kind of leaned into what I wanted to talk about, because when we first talk about PTSD, I think a lot of people became introduced to it. When we talk about soldiers, combat, those on the front lines, we understand that that was, for many people, the first introduction to PTSD. But now, with a lot of things happening within our society, PTSD continues to rise. Can you just give us a little bit more of an umbrella as to what are some of the things that or the PTSD, where we can find it affecting people? You talked about healthcare workers, but where else are we finding PTSD on the rise?
Well, we find PTSD in general. Anybody who's experienced an event that puts their life at risk, or where they witness someone else's life at risk, or you hear about a loved one. So participating, witnessing, and for close significant others, just hearing about it third hand. That includes a range of activities that happen in daily life, unfortunately, like motor vehicle accidents, industrial accidents, natural disasters, interpersonal assault, from gun violence to sexual assault, the whole range of interpersonal assault. And then the big ones that make the news more are combat-related PTSD, and now with the pandemic, healthcare-related PTSD, and all first responders, cops, firefighters, EMTs, nurses, everyone. So I don't know that it's on the rise per se in the other groups, so much as there's much greater awareness, and it, the number you quoted would certainly suggest that overall the rates are higher a little bit.
Yeah. When we look at what's going on right now with post-traumatic stress disorder, we know that many times that comes later on. That's post-traumatic, later on in the game. Talk to us about symptoms, because how does a person able to say, I've got post-traumatic stress disorder? Because sometimes people don't even know. So what are some of the more common symptoms that we can see arising in people?
Right. Actually, often you make an excellent point there. Not only do people often not know, they often mislabel the event that occurred to them as not being putting them at risk for PTSD. I've literally had people who were at the World Trade Center go, "Oh, I didn't realize that," or our healthcare workers say, "Oh, well, that doesn't apply to me. That applies to our soldiers." I'm like, no, it's anybody whose life was at risk. As I said, witnessed it or heard about a significant other. Is that Did you want to ask
Yeah,
me more about that?
yeah. Well, we understand that it's almost like a silent disease that affects so many people. And when we
Right.
talk about the
Right.
numbers, I gave you the 1 in 11 people. That's what
Right.
we know of. But I think it's safe to say that there's a lot more that go on undiagnosed.
Yes, well, and that is that. Thank you again. That is a great concern. I mean, the average number of treatment sessions for in psychotherapy for anything is zero. And so, yes, mostly people don't come in for treatment. They don't recognize it in themselves. So, some hallmark symptoms like flashbacks and images popping into your mind are often people will say, "Oh, well, it's just a normal reaction to an acute stressor or something really bad happening to me." And sure, yes, that's what happens in our brain. There's a psychobiological cascade of events. We start pumping out neurochemicals so that our body and our mind prepares to do what needs to be done in trauma, and then those images pop into mind. And so that's one symptom, though. Others are that you begin to avoid people, places, things, emotions that are related to your trauma, to the point where you may not recognize that what happened to you, like being at the World Trade Center or being a frontlines healthcare worker who had to come into work every day during the pandemic, puts you at risk as well, all the way to car accidents and what have you.
We talk about stigma. There's a stigma in just acknowledging about PTSD, but also there's a stigma when it comes to actually treatment because so many people think that
Right.
it has to be so invasive. But what are some of the treatment options that are available for people when it comes to PTSD?
Well, the most widely accepted and validated across multiple studies and endorsed by many professional groups is known as exposure therapy, where you sort of systematically and gradually recount what happened to you to your therapist. And that helps our brain almost at a preconscious level learn to tolerate the anxiety and fear, and your brain begins to learn, oh, well, going to a hospital doesn't put me at risk necessarily for a deadly virus like a pandemic, or going downtown or seeing an airplane. This is not the World Trade Center happening again. So your brain learns that certain cues to danger, like buildings, planes, hospital gear, walking into your place of work at the hospital, are no longer are safe now. Another form of therapy that is gaining a lot of evidence for now is interpersonal therapy. And in that approach, you focus on your interpersonal relationships. With PTSD, you often become angry, irritable, or withdrawn and numb. And so the level of interpersonal conflict goes up, and marital difficulties, difficulty at work with colleagues and supervisors. So instead of focusing on the trauma itself, it focuses more on how it affects your life. And in our clinic, we do both. We also pioneered the use of virtual reality exposure therapy back at the World Trade Center. And an advantage there is people seem to like it. In other words, they prefer it. So if you ask a group of people what form of treatment they prefer, they will say virtual reality. Now, in our last study for combat PTSD, whether they got the imaginal form or the VR form, people got better with either treatment, even if they preferred or wanted the VR. So that's the good news. But the thing about getting the treatment you prefer is people are often more motivated and stay in treatment. And we did show that if you're depressed, you might be better off getting the VR than the standard imaginal exposure. So there are at least three validated treatments that are short term and evidence based. And all the PE or exposure therapy and IPT can be done over Zoom now. So in terms of the stigma, you don't have to go to a mental health clinic or somebody's office to have treatment these days. You can do it over Zoom or in person if you and your therapist think that that's what's best for you.
Yeah. Dr. Difede, a lot we put on the table. We got to leave it there. Thank you so much for joining us.
Okay, thank you so much for inviting us and spreading a message of hope and awareness.
Yeah, it's an important conversation to have. Dr.JoAnn Difede, Director of the Program for Anxiety and Trauma Stress Studies. Now, if you want more information, you can visit the website at patss.weill.cornell.edu and then call their office number at 212-821-0783. We encourage you don't go anywhere. We'll be back with more Open coming up right after this.